when it comes to my kids drinking the water, I'm afraid.
Their tap water was laced with bacteria, and for more than 15 years, their water treatment facility did not meet even the most basic provincial standards. But nobody was listening. So we spent months in the Oneida Nation of the Thames near London, Ontario, gathering evidence, fighting for documents from the federal government, and meeting with the people who live there. The story we eventually published sparked public outcry about a disparity in drinking water quality between the First Nation community and the non-Indigenous neighboring town where the tap water flowed from a state-of-the-art treatment system. In the aftermath of our reporting, the federal government committed $43 million to ensure clean water is on its way to the people of Oneida. My name is Robert Cribb, and I'm the director of the Investigative Journalism Bureau. And these are the kinds of stories we do. In-depth, collaborative investigations that dig deep into the social and economic inequities that disproportionately impact the most vulnerable. We report on the systems that allow these inequities to exist, and we search for the solutions to make them better.
In the short 3-year existence of the IJB, we've had significant public impact in many areas, including youth mental health. For our series, Generation Distress, we relied on a key element of our model, bringing journalism students into our projects to both train them in investigative techniques and draw from their unique perspectives. We partnered with more than 80 journalism students from universities across North America to tell the stories behind the unprecedented spikes in youth suicidality, depression, and anxiety. It was told through the heart-wrenching accounts of families impacted by the crisis and those who have dedicated their lives to fixing it.
We know it has affected some people's lives. They've sat down and had a different conversation with their children. They've looked at their kids in a different way. They've gone out to seek help or encouraged their kids to seek help. And so in all of those little events that we know happened, and hopefully dozens more that we don't know where it happened, it was all worthwhile and nothing we regret.
After we started publishing, millions of dollars in government funding flowed into mental health systems across this country.
What if I told you there's an invisible radioactive gas killing thousands of Canadians every year, and it could be in your home? Our groundbreaking reporting on radon has dramatically increased the public's awareness about the deadly gas that claims the lives of 3,000 Canadians a year, and led to a spike in testing across the country. We were able to break new ground on this little-known public health risk, thanks to another foundational element of our model: collaborative partnerships. In this case, we partnered with academics who shared national radon data on homes and offices across the country. Based on this exclusive, powerful, and illuminating data, our reporting put the risks of radon on the public agenda in Canada and led to an ongoing series of articles that continue today.
Sometimes our journalism reverberates throughout the halls of Canadian power. A cluster of homes in a northern Ontario town are sitting on a deadly secret. The IJB first reported on radioactive waste from long-closed mines buried under homes in Elliott Lake. The government says it wants nothing to do with the cleanup, but after our story came out, the demand for change went all the way to the House of Commons.
It shouldn't be a family's responsibility to deal with radioactive waste, nor bear the burden of health risk caused by the uranium mining industry.
Every year, an obscure provincial program suspends the driver's licenses of tens of thousands of Ontarians for alleged medical reasons. But our investigation found that the system is vulnerable to abuse and misjudgment by medical professionals and transportation authorities. Ontarians whose licenses are unjustly suspended can lose their livelihoods overnight, lose trust in the healthcare system, and experience intense psychological distress. Our series inspired a private member's bill that aims to reform the system.
Speaker, journalists are investigating a controversial government program that has caused many Ontarians to unnecessarily lose their driver's licenses and their livelihoods. Public servants prepare detailed answers to reporters' questions, but according to records uncovered by Freedom of Information, the offices of the Premier and of the Minister of Transportation blocked them from going out. 35 questions should have had 35 answers. Why did the Premier and the Transport Minister try to keep this information from the public?
As a summer intern with the IJB, I got to do serious investigative work at a point in my career where other news outlets would have overlooked my potential. I'm young, I just graduated, and I found myself working on projects that made it to the front page of the Toronto Star. In the way that the IJB is built, they don't place the most value on how many years you've worked in investigative journalism. They're looking for fresh minds, new minds, open minds. They care more about your values and how dedicated you are to the work, so they place a greater emphasis on the development of young journalists like myself.
We're a small nonprofit organization funded by people who want to see positive change in our world. We believe we've become an important new voice in Canadian journalism at a time when the very foundations of the country's mainstream media are under threat. There's much still to do. Our reporting has raised new questions we want to answer and threads we want to follow, but we do need your help. I'm hoping you might consider supporting us with a financial contribution. As a nonprofit newsroom, all donations to the Investigative Journalism Bureau are tax deductible, and they'll go towards funding that will help us conduct this kind of intensive investigative research and find the voices and the heartbeats and the stories that are making a difference. Beyond the significant influence we've had on policy and reform, we're perhaps most proud of the impact we've had on the everyday people who lend their voices to our stories. Michael Fraser ended his life through medically assisted death in July 2022. We were honored to spend the last weeks of his life visiting with him in his small apartment where he was trapped. Without an elevator and unable to walk downstairs, he couldn't leave the building. His life, in his own mind, was unworthy of living. This is the story we told, and this is what his wife Anne had to say.
The care and the dedication you guys took to put that story together, and it was a process. And we got to watch that unfold, and it was so powerful. And the day it came out, I could feel that calmness, and I could feel that Michael was happy. And you guys made that happen for him. And I am so grateful to all of you. You have no idea.